Okay, hot take. What if I were to tell you that you care too much and caring so much is getting in the way of you getting better outcomes for your patients? All right, hear me out. I want you to take inventory of something or think about something. In an average new patient evaluation or even in follow up sessions, how many times are you asking the patient, does this hurt? Think about it. How many times do you ask it? Do you ask every single time you push on something, every single time you do a manual muscle test, every single time you have them go through some sort of movement? I've interviewed and worked with so many new grads, and I can tell you overwhelmingly, they ask it too many times. Now, why is this getting in the way of building a therapeutic alliance? Well, for one, the majority of the patients that you're going to see that have been dealing with pain for a long time, they're not coming to you because of the pain. They're coming to you because they can't do something. So when you focus on that pain so much and ask them every single time you do something to start thinking more about the pain, they realize that there's something missing, there's something wrong, and that there's a disconnect between why they're there to see you and what you're talking to them about. And so that trust, that therapeutic alliance is gone. You need to be focusing more on what they want to do and what their real outcome is. And that goes back to the conversations that you're having with them before you even get them on the table, so that you can find out what's driving them and what's getting them to be in front of you right now, coming to physical therapy, a thing that they don't really want to do in the first place, right? So pay attention, think about it, be an expert. You're supposed to be an expert. And being an expert is understanding what that person in front of you needs and wants from you. And the more that you focus on pain, on a thing that you think is driving them to come to you, and they may even be telling you that's the thing that's driving them to come to you. But look, we both know that if they've been dealing with pain for years and years and years, it's not the thing that made them come to you, right? It's the thing that all of a sudden they realized is important to them, which is maybe playing with their kids, which is maybe losing weight, which is maybe staying active, which is maybe being involved with a friend group that does things that now they can't do because of this pain. So get to the root cause of their problem. Stop focusing on pain when that's not the thing that's important to them, and take some time to really understand what it is that drove them to get there. That will build therapeutic alliance. That's going to get you better outcomes. That's going to build trust between you and your patient. And it makes such a big difference in being able to be the expert versus wondering why that patient, why that client never came back to see you after the first time when you were so concerned about their pain and all you wanted to do was fix their pain. Be better.